we ran out of oxygen. This population needs to understand what an ambulance does. Some road users who do not count that as important, and so no matter how much the ambulance driver is trying to insist, some people adamantly don't want to give way to this vehicle. Then the road network too is not the best. The road network, sometimes you carry a patient before you reach some in another town, the patient may die just because of the poor network, even within our own setting here where we are. The general public needs to be sensitized on some basic way of handling serious cases that people need to know, even at the level of the homes, should be known by especially the health personnel who perhaps handle this patient before they are handed over to the transporting team.
Hello everyone, welcome to African Health Insight. In today's episode, we shall be discussing issues related to patient transportation in our communities. We will not forget to thank you for your contributions. We have in our midst one of our colleagues. I would like him to introduce himself, tell us who he is, and walk us through today's discussion.
Thank you very much, sir. I'm Dr. Joseph, senior nurse anesthetist.
Thank you very much for coming. It's always a pleasure to meet you. And today we want to look at issues related to patient transportation. So, can you just share with our panelists your experience in transporting patients?
Let me share with you vividly an experience I had of a patient evacuated from Bamenda to Yaoundé. This was a very serious patient that was in coma, intubated, going there for specialist care. On our way, we ran out of oxygen. True, this is not something to let those in the vehicle, even the ambulance driver did not know that I ran out of oxygen, because I was afraid that maybe the carers will know, which would have been so much chaos. But I want to tell you that it was so laborious to use the ambu bag to keep ventilating from around Makenene. That was about halfway to keep ventilating by hand to arrive at the hospital. The good thing is we arrived safely, and the patient was handed over to the experts to continue management without any problem.
Have you had any situation where the outcome was good and you felt the problem actually stemmed from poor transportation?
Sometimes you may have to transport and use your own knowledge in order to do this. Then the road network too is not the best. The road network, sometimes you carry a patient before you reach some in another town, the patient may die just because of the poor network, even within our own setting here where we are. And another thing too, I think too, is that transporting patients, the general public needs to be sensitized on some basic way of handling serious cases that people need to know, even at the level of the homes, should be known by especially the health personnel who perhaps handle this patient before they are handed over to the transporting team. Sometimes you are taking a patient somewhere with a note, only to go there and discover that there is no bed, there is no room to accommodate such a patient. And in the course of time wasting, and so on and so forth, that will be detrimental to the patient. Yes. I had a patient that died already sometimes when we arrived right in Yaoundé, because there was no room in one of those big hospitals to receive the patient, and we had to negotiate to bring back the patient back to the bed.
What was the experience transporting a patient from Bamenda to Yaoundé and then taking the patient back to Bamenda because you could not allocate back to the hospital?
The first problem was telling the carers that the patient is gone. They do not believe it. After about 30 minutes, they were allowed them to cry and accept the situation. The next thing was for us to also plan to go back. The next thing was to inform the administration of the establishment where we work, to let them know that the patient will arrive in Yaoundé, but we have to go back. But this time, we are coming back with the cops because the patient could not make it right there. And the family accepted. We had to bring the cops back. Not only was it so bad for the family, but even me, myself, like the personnel. So instead of transporting a patient that I'm trained to transport, this time around, I was transporting the cops.
our population, do you think they need to sensitize better on the importance of giving way to medicalized transportation of patients?
Mr. Suvan, I think that you're touching a very important point, especially at some urban areas where the town is very congested. This population needs to understand what an ambulance does. They need to know what it means when the sirene, when the lights of the ambulance is on and alarming. Some road users who do not count that as important, and so no matter how much the ambulance driver is trying to insist, some people adamantly don't want to give way to this vehicle.
Apart from the physical nature of our ambulance, the route issues, in terms of materials for transportation, do you think that is also an issue? And how has it affected the patient transportation?
There is an AED, for instance, that was existing in the ambulance, but as we speak now, it is not good because the battery is down. I will need a new one. I think that apart from that, those who are transporting, they need to be trained on the usage of all these things. The patient I transported that I said died in Yaoundé, then we did not even have an AED. That patient did not have I did some CPRs to the patient, but I think that I needed to have also used an AED to stimulate the heart. So that is just one of the many things that needs to be equipped in a medicalized ambulance. And then the personnel trained on how to use them. In terms of material, we don't have enough material in order to do this adequately as it's supposed to be. Remember I talked to you about the patient that died because we ran out of oxygen.
The level of preparedness, our level of preparedness to transport these patients is not enough.
It is not enough. We really need courses on preparing both ourselves and then the ambulance and the patient for evacuation. It's very important that people be trained, that we should know what are the standards of what a medicalized ambulance should be. Is it complete? Is the oxygen complete? Can it go for that distance?
Exactly.
And now, the materials we are using, are they all working? Can these materials, can they use them?
We've had situations where patients are transported on taxis, patients are transported on bikes, unconscious patients. So have you had experiences of this type of transporting patients?
Yes, I've had the experience of a patient transported in a wheelbarrow. That was on the ghost town day, and that mama, I saw this mama with the son, this grandmama and the son carrying to the hospital in a wheelbarrow. They needed to reach the hospital, and that was the only means they had to reach the hospital. I still have the experience of a lady that was transported on the bike, and even before they reached the hospital, the lady put to bed by the hospital gate. Every means, I've also seen people carried on the back because there was no means, there was no other way to transport them. Those carrying, they needed at least to have known some basics in first aid in order to help the patient to reach well. Sometimes you see people carried inside the taxis. Before they arrive at the hospital, the patient is in there. They say there's no line. Patient, people coming, died. And maybe it's a patient that would have arrived at the hospital and perhaps attended to and a life saved. But that patient, maybe because of positioning, which is what those who were transporting did not know. So I think that even the population, they need to be sensitized.
What are some of the risks of transporting an unconscious patient on a bike? Maybe you better tell us.
Let me tell you something. We've had gunshot cases that are transported on the bike. The bike man is in front, and then the patient is behind, and then some other person, a carer comes behind and holds the patient. They don't understand what it means for the patient's neck to be bent like that. In that position, the patient cannot breathe. In that position, the patient will not be able to breathe or swallow, which is what the patient really needs. So just secretions will be enough to choke this patient and kill the patient. You can also think about transporting patients from some of the villages to our town here. Because of the poor network, you can carry a patient, even if you know what to do, the bad road itself will be responsible to kill the patient before you arrive in the hospital.
As you rightly said, maybe we need to have some first aid courses for the general public.
Excellent.
Yeah, so that if a patient goes into an arrest or into unconsciousness, they can do some first aid and call for an ambulance, and the medicalized team comes and pick up the patient from where the patient
That means that they should have that system where there's an ambulance call center.
is.
Then there is a team of personnel to follow the ambulance to pick it, and then the population too, they need to also understand that we need to give these basic first aid measures to this patient, and then the call for help is the call for help and wait for the ambulance to come out. If that is known and the population is educated on this, I'm very sure the patients will be transported well to the hospital.
So once more, I want to thank you for the insightful discussion. I want to know what are some of those strategies you've already mentioned in training the general public on first aid, basics of first aid. So if you had to summarize like the strategies we can use to enhance patient transportation in our communities, what are those strategies you can put forward?
Without addressing any issue of the powers that be, what is true is our population, they need to understand the importance that comes with medical care. The specialists are not enough in all the health institutions we have. We have a level of the districts and level of the villages. There are some places that there are no specialists there. And these people, they equally have the same rights for medical care like you and I who are in cities. They need to be transported from there to here. So I think that we need trained medical personnel. We need to have an ambulance call center. We need to sensitize the public that this is existing. We need to train the people on basic life support so that they should understand the basics, the basic first aid measures to be done on a patient that is critically ill and that needs to be evacuated. Maybe a patient that is unconscious or that is having an arrest. What are the things they need to do until help comes in? And then we have some of these things available, like the ambulance available, whether medicalized or not even medicalized. It's good to have something that not having anything, and then it's for people trained around them. Then it could be a start to helping our population sensitize on the importance of proper medical care, how to take a very serious condition to be evacuated to where there is care, where the specialists are found.